I need to know how to get baby out of breech position.
Your kid should not go through life backwards, and you really do not want to have him start out that way. How far along are you?
Around 36 weeks, why?
If you were 30 weeks along, I'd say it does not matter, because he'll probably turn. Now that you could give birth any day now I'll say you can be concerned.
So how do I get him to flip?
One solution is kneeling on a mat with your butt in the air, your head and chest on the floor. The idea is to give the kid the room to actually turn around on his own.
That does not seem like enough to get him to flip.
You're supposed to do that pose for at least 15 minutes at a time, several times a day. And do not let your thighs press against the uterus, or you'll prevent the turning you want.
That would certainly count as the second most awkward time to respond to a text message.
What is the first?
When you're trying to poop, and they ask you what you are doing.
Tell them you are trying to avoid a C-section. You could also do a breech tilt, which is a fancy term for putting a pillow under your hips with your knees bent to try to give the kid a chance to flip.
I suppose that's supposed to be done several hours a day.
At least 10 minutes at a time several times a day, though this pose is much easier to explain if someone walks in on you. Just say it is back pain prevention.
At least it is a position where it is easier to text with other people to not be as bored.
It is more likely to be successful if you make sure the kid is active and your bladder is empty.
Which is around 15 minutes these days.
If you want something more exotic, the Chinese use moxa sticks on acupuncture points to try to help the baby turn. They usually put the burning stick on the points around your toes to make the kid turn.
My jumping in response to that may be enough to make the kid move.
If that does not work and you're closer to your due date, the doctor may recommend trying an external cephalic version or ECV.
Thank you for explaining the TLA, the three-letter acronym. What does the medical term actually mean?
The doctor uses slow but constant pressure to try to make the kid turn. And the doctor can try again and again, even up until your labor has started.